guys, I want to quickly go over roadblocks to therapeutic communication. So it's important to be sensitive to patients' unique personalities and needs, and it will help healthcare professionals to avoid these roadblocks to communication. These roadblocks close off therapeutic communication and prevent quality care of the total person. So some things that can be a roadblock are listed here off to the side, roadblocks to communication. Some of these include things like reassuring cliches. An example of a reassuring cliche is like, "Don't worry, I'm sure it'll be fine." But is it though? That may just not be what the patient wants to hear. Giving them more of a listening ear is going to be much more opening for a conversation. Moralizing or lecturing. If you're smart, you'd lose 50 pounds and it wouldn't be such a problem for your diabetes and hypertension. That's probably going to close the patient off pretty quickly, right? You probably don't want to have a conversation with someone that just said that to you. Requiring explanations. Why would you not go to chemotherapy, Mr. Gordon? He's probably going to feel pretty defensive at that point in time, right? Let's talk about ridiculing or shaming. It's not prostrate cancer, it's prostate cancer, Mr. Gordon. Again, we don't need to ridicule or shame or make fun of our patients, even when they say things incorrectly or misunderstand something that we've said. Healthcare and medical terminology and things like that are really confusing for those individuals that have never worked in it or have any experience with those things. Defending and contradicting. I assure you the physician is very busy. He will not see you until he is finished with his other patients. So we don't need to defend the physicians, or really anyone, and we don't need to contradict ourselves either. This one is pretty tricky because we often want to defend ourselves or our coworkers when things aren't going right in the clinic. But be sure to not fall into this trap and simply apologize. I'm so sorry for the delay. I'll let you know as soon as it is your turn to be seen, something along those lines. Again, we don't need to defend or contradict ourselves. Shifting subjects. Yes, Mr. Jover, your work is very, very interesting, but I must ask you to sign this permission form to test for HIV. So this often happens with some of our elderly patients. They want to tell us their whole life stories. We don't have enough time to always listen to everything our patients need to say, but it's important to not just cut off our patients when they're trying to communicate with us. There may be some information that's really important that they're just taking a while to get out. So be careful with shifting subjects during those times. Criticizing. Miss O'Keefe, why in the world would you stay with your abusive husband? Again, that patient's probably not going to want to continue talking to you if they're being criticized for their actions. Threatening. There's no way you'll get rid of this cough if you do not stop smoking. I'm all about some tough love, but we don't need to threaten the patients, right? Or you're going to get lung cancer if you don't stop smoking, right? We don't need to threaten our patients. We need to simply educate them. Maybe say something along the lines of, if you continue smoking, it does increase your risk for lung cancer. That sounds much better and is less threatening than the other way that we just stated. Giving advice or approval. If I were you, or you should, patients often ask for advice, or they ask providers or medical assistants or nurses what they would do in certain situations, and it's really important to not give any of your own advice or your own approval. Like, yeah, I think you should do that. I think that's a great idea. Or if I were you, I would do the radiation because it's not up to you. It is their personal decisions. It's their health, their body. So try to avoid giving advice or approval. And then lastly, stereotyping. This is when we're grouping people in same categories. Sometimes this is with races or different things like that, but it's important not to stereotype someone. Just because they appear homeless doesn't mean that they are, or that they are unintelligent or things like that. So it's important not to stereotype individuals by any means. So those are some roadblocks to communication. Remember to review these because it's important and to avoid when we're trying to communicate therapeutically with our patients.